This video is for you if you are around the age of 40 or more and dealing with any of these struggles: irregular periods, hot flashes, waking up drenched in sweat, or trying to focus at work but your brain feels foggy, feeling so exhausted that even dealing with simple tasks feel overwhelming, snapping at your loved ones because your mood swings are all over the place. We're dealing with constant body aches that just won't go away. If any of this sounds familiar, you might be experiencing perimenopause. In this video, we are going to break down exactly what perimenopause is and how your hormones are shifting. Then, we are going to dive into what to expect when you visit your physician. Next, we'll explore what are the root causes of these symptoms. In other words, why some women struggle and suffer while other women just breeze through it. And finally, how a holistic and functional medicine approach can help you naturally restore your health and youthful vitality. Stay with me until the end for actionable tips you can start right away and special bonus just for you. Hi, I am Ghada Eid, an internal medicine physician with over 20 years of experience. And like many of you, I've went through the ups and downs of perimenopause. This journey is deeply personal to me, and it's why I am so passionate about helping women over 40 restore their health and vitality, shed excess weight, and feel youthful for life. So, what exactly is perimenopause? Before we dive in, I invite you to grab a cup of coffee or tea as we go through the fascinating journey of our hormones, step by step, from the very first signs of womanhood all the way through perimenopause and beyond. Today, I'm going to use the STRO plus 10 classification, which is the most well-recognized system in the medical literature for reproductive aging. To help us visualize this journey, I'll be referring to this graph, which I borrowed from Professor Jordan C. Pryor. Here is estrogen, or to be more specific, estradiol, and the pink one is progesterone. They are the two hormones we will be following today. This graph will guide us through the hormonal shifts that take place through our lifetimes. Now, let's begin where it all started. Here, do you remember the moment you got your first period? That experience we all share is called menarche. It typically happens around the age of 12, though it can range from 9 to 15 years old. This wasn't just a symbolic moment. It marked a significant shift inside our bodies. In menarche, estrogen levels, which has been low throughout childhood, as we see here, began to surge and increase. It's as if our bodies were stepping into a brand new world filled with possibility and growth. At the same time, progesterone remained low, as you can see here, until our cycles became regular. And this combination of high estrogen and low progesterone is why so many of us has experienced those heavy irregular periods as teenagers. And it's all part of the hormonal dance, and while can feel overwhelming, it's just the body figuring itself out. This stage where hormones start to regulate is like the opening act of our reproductive journey. So this is our reproductive journey and starts with menarche. Now, fast forward to our 20s here till mid 30s. And this is what is called peak fertility in our reproductive period. Here, during this time, everything feels more balanced. The estrogen and progesterone are working in harmony, regulating our cycles like clockwork. You might remember how predictable your periods became and how you could almost plan your life around them. That mid-month energy surge when estrogen peaks around ovulation, that was your body in full bloom. So these years, again, when we feel vibrant and strong, biologically speaking, this is the prime time of starting a family. But today, many women are focusing on their careers or personal growth during these years. And it's a balancing act, juggling the rewarding roles of motherhood and personal ambition. Of course, this graph doesn't include the change that happens during pregnancy, but this is outside the scope of this video. Now, as we move into our late 30s and early 40s, here, this period, things start to shift again. This is what the Stroh plus 10 classification calls as the late reproductive stage. In other words, women can get pregnant during this time, but there are some changes and some challenges. So the changes are subtle at first. Your periods might come a little earlier or a little later than usual. It's like your body is gently preparing you for a new phase, which is the star of today video, perimenopause. This period. Okay. So, what is perimenopause? Here, the changes become more noticeable. Just like puberty, this is another major transition, but in reverse, as you see here. This is estrogen here, and in perimenopause, it can get higher. Yeah, but again, it can get lower. So estrogen fluctuates, sometimes spiking high, sometimes dropping low. This imbalance with high estrogen paired with something more. As you see here, you can see that progesterone is going lower. Yeah. This is why many of us experience heavier periods again in our 40s. Much like when we were teenagers, our bodies are adjusting once more, preparing for the next chapter. Okay, so during perimenopause, these hormonal fluctuations can cause also the classic symptoms that I discussed in the beginning and that discuss deeper later on. The hot flashes, mood swings, night sweats, or even brain fog. You might be sitting in a meeting and all of a sudden it feels like you are burning up from inside, or waking up at night drenched in sweat, wondering what's happening. That's perimenopause, a phase where estrogen is high one moment, low the next, as we see I've shown before, while progesterone continues to decline. But here's the thing. It's just like puberty. This phase won't last forever. Perimenopause can last from 4 to 5 years up to 10 years. But eventually, both estrogen and progesterone will stabilize at lower levels when we reach menopause. Signifies the end of our reproductive years. I want to remind you, it's the beginning of a new phase where we can embrace all the wisdom and experience we have gained. Now, let's go to menopause. Here. So, what is menopause? Menopause is the stage that officially marked when you have gone 12 months without period. Let's see this point here. This point is our final menstrual period. And for 1 year, this is still part of perimenopause. 1 year after the last menstrual period is where menopause starts. Menopause is the point in time. What follows menopause is postmenopause. Okay. Menopause usually happens around the age of 51, but it can vary. Anywhere between 45 and 55 years is all normal. And significant milestone as we can imagine, signaling the end of our reproductive years. Something to note is women can get pregnant within 2 years after the last menstrual period. But of course, this is very unusual, but it happens. Scientifically, this signals the end of our reproductive years. But let me be clear. If we are blessed to live until this age, it's a new beginning. Menopause is just can be a gateway to a new phase of self-discovery and empowerment. As I mentioned before, we are moving here to the stage of postmenopause. And it's when the symptoms accompanied by perimenopause start to stabilize and the hormonal shifts settle into a new low. Okay? New low levels. We are not low, but the levels of our hormones are low. Okay? And now is the stage where we embrace all the wisdom, hopefully, that we gain through every stage in our journey and using it to fuel this new chapter. Deep down, even as we age, we feel far from done. There is still this spark inside many of us, the desire to give back, to grow, and to live with purpose. But to do that, we need to prioritize our health, our energy, and our well-being. Now let's dive into perimenopause. Now, if you are like me and started having symptoms, the first step is to visit your physician. You need to be evaluated. The goal is to have your doctor say, your blood tests look great, there's nothing major going on, and it's literally perimenopause, or simply your body's way of adjusting with age. Now, I get it. This might not sound like the most groundbreaking news, but trust me, it's actually good. No major disease, that's always good news. When you see your doctor, they will likely evaluate you based on your age. Here's how that usually looks. So, for women under 40 to 45, your doctor might start by doing pregnancy tests and check hormones like FSH, which is the hormone from the pituitary that stimulates the production of estrogen, and also the eggs, prolactin, another hormone for milk production, the TSH to check thyroid function. And these tests ensure there is no other cause for your irregular cycles and symptoms. Now, if you are a woman over 40, usually no testing is required unless symptoms are severe. In those cases, they might check your thyroid function or run a full medical panel. All depends on the discretion of your physician and your general condition when you present it to the doctor. But now, once you are fully evaluated and any form of illness is excluded, here is where conventional medicine, sometimes in my humble opinion, misses the mark. So it tends to treat each symptom in isolation rather than looking at how they are interconnected. For example, hot flashes. If you have hot flashes, you may be offered hormone replacement therapy and other medication. I'll touch on hormone replacement therapy later. Mood swings or depression, you will be prescribed antidepressants or anti-anxiety medications. And if you have sleep disturbance, you may be advised to about sleep hygiene or prescribed sleep aids. If the problem is body aches and fatigue, pain relievers or light exercise might be recommended. Physiotherapy maybe, depends on your condition. Now, this approach might provide some relief, but let's be real, many of us are left with only minimal improvement. And that's where the frustration creeps in. This is, my dear, is when it's time to seek advice that goes deeper. This is the time when I am, as an internal medicine physician, failed to help myself and had to look outside the conventional realm of medicine. So you deserve to understand. First of all, I want you to understand that you deserve to know why your body is behaving this way and what's really driving these symptoms. You don't have to feel stuck because there is the way out, and this is where the functional medicine approach comes in. It addresses the root causes of your symptoms so we can restore your health naturally. What's causing these symptoms? First of all, I spoke about the hormonal fluctuations, but the reason some women glide through this phase while others struggle lies in how their bodies handle hormonal changes. When our bodies are inflamed, when liver detox is compromised, and when we have gut health issues or high cortisol from stress, this creates the perfect storm. These imbalances can make perimenopause symptoms much worse. The good news is, by addressing these root causes with lifestyle changes, optimal nutrition, targeted supplements, we can thrive through this transition, not just survive. So, what exactly is functional medicine? I'm just saying functional medicine here and there. And for people who doesn't know, functional medicine is a patient-centered approach. Compared to conventional medicine, whether they like it or not, it is a disease-centered approach. I don't want to be controversial in this video. Let's go back to functional medicine. So, functional medicine is a patient-centered approach to healthcare that focuses on identifying and addressing the root causes of illness. Instead of just treating symptoms, functional medicine looks at you as a whole: your lifestyle, genetics, body systems, health, and your environment. This approach allows for personal treatment plans designed to help you achieve optimal health and well-being. So let me clarify. I want to share with you a concept I developed to simplify functional medicine, and I call it the trifecta of illness and wellness. Looking at these three intersecting circles, each representing a crucial aspect of our health. First of all, the psychosocial well-being. In other words, our mental and emotional health. This circle represents the thoughts, the emotions, feelings, stories that we tell ourselves, how we identify ourselves, how we think, in other words, and how we feel shapes our behaviors. And of course, as a consequence, our overall health. There's a deeper element of that, but it's not in the scope of this video. Maybe later we can speak about it. But in a nutshell, positive thoughts and emotions can lift our well-being, while negative ones can weigh us down. And this is what some experts call the most powerful medicine of all. And I couldn't agree more. Now, the second circle is the external environment. And this includes your nutritional status, hydration, physical activity, connection to nature, exposure to toxins and viruses. So if we have nourishing foods, clean water, regular movement, fresh air, all this can transform our health. On the flip side, a poor diet, lack of movement, and exposure to harmful substances can lead to illness. Finally, our internal environment and body systems. This represents our internal body systems and biochemistry. Things like hormone balance, gut health, metabolic function, immune health, detox health. When our internal systems are in harmony, we thrive. And when they are out of sync, we experience symptoms and bad health challenges. And these three areas are constantly interacting. And when they are in balance, we thrive. When they are out of balance, we feel sick and exhausted. The good news is, and this is the whole thing that I want you to get it, you are in control of two of these circles. That can change everything: our psychosocial health and our outer environment, our interaction with our environment. These are the tools and the keys to change our well being and health. So, let's see how functional medicine approach can help perimenopausal symptoms. The first step in functional medicine is to conduct a thorough comprehensive evaluation to understand the root causes of your symptoms. And this includes an interview, a very detailed interview, and also running conventional tests and other tests. Think of it like being a detective piecing together clues to solve mystery of what's really going on in your body. Once we finish this evaluation, based on that evaluation, we design a personalized plan that is tailored to your unique needs. It can start with small intentional changes that over time can have a huge impact on your overall well-being. Or if you are ready to fully embrace change and leave the struggle behind, we can go for a complete lifestyle overhaul. Either way, you can get a clear roadmap guiding you through each step of your journey to better health, making the process easier and more empowering. Now, even though it's best to have a personalized plan tailored to your unique needs and your body's specific requirements, there are some general guidelines for optimal health during perimenopause and that apply to most women. These guidelines can help support your hormones, energy levels, and overall well being as you navigate this transition. In my experience, I found out that there are two master keys to restore your health: optimal nutrition and stress mastery. The food we eat has a significant impact on hormonal balance, inflammation, gut health, and overall. Simply said, you add food to heal and eliminate what may harm you. So, for example, you add food that help you heal by filling your plate with leafy greens, colorful berries, fatty fish like salmon. These foods fight inflammation and nourish your body from inside out. Add in cruciferous vegetables like broccoli, Brussels sprouts, and others to support liver detox and hormone metabolism. On the other hand, try cutting out gluten and grains to see how your body reacts. Actually, this was the thing that make the massive difference for me. It's like day and night. So every woman reacts differently, but I believe it's very rewarding to try cutting out this gluten and grains and just try it for 2 weeks. So, because many women find that inflammation, as I told you, including myself, decreases and symptoms improve. Actually, for me, symptoms disappeared, just went away in 4 days. I can tell you my story later, but let's go back to the rest of the information. Back to what to eliminate. We can also better to stay away from refined sugars and processed foods, which can increase inflammation and disrupt your hormone balance. Focus on whole, unprocessed foods to feel your best. Also, an important part of nutrition is hydration. Please, this is the simplest and easiest thing to do and can make a massive difference in your overall health. Staying hydrated is key. Drink plenty of water throughout the day and at least 8 glasses at least. And more, of course, if you are active or you are overweight or in a hot climate. Proper hydration supports digestion, detoxification, and pretty much every function in your body. So now let's talk about the second master key: stress mastery. Because let's be real, stress is inevitable. We can't always control the unexpected twists and turns life throw our way. But what we can control is how we respond. Now, stress mastery is about navigating the uncontrollable with ease and grace most of the time. No one is perfect all the time. Our goal is most of the time. So it doesn't throw us off balance. It's about recognizing when stress is starting to build up and knowing how to bring yourself back to a place of calm. This is crucial for balancing your hormones. When stress levels rise, cortisol spikes, which can throw off your hormonal balance. and worsened symptoms. Simple practices like praying, connecting to higher being, if you are a believer, that's a very important part of your daily practice to manage the stress. Learning how to process your emotions, or even taking a few deep breaths, can work wonders in lowering cortisol and helping you feel more grounded. Also, one of the most powerful yet often overlooked aspects of stress mastery is getting enough good quality sleep. Sleep plays a huge role in hormonal health. When we are sleep deprived, cortisol levels rise, and our body's ability to regulate the other key hormones like insulin, estrogen, and progesterone gets disrupted. Prioritizing sleep not only helps manage stress but also support, as I said, better hormonal balance. Creating a consistent sleep routine, reducing screen time before bed, and creating calming evening environment can make a world of difference in how rested and rejuvenated you feel. At the same time, another form of physical unwanted stress to navigate, we want to be mindful of what we allow into our environment. This means being intentional about the food we eat, choosing organic when possible, and switching to natural cleaning and personal care products. I make mine at home, and if you want me to share recipes, I will do later also. Reducing toxins includes as well the energy we surround ourselves with. When we clear our physical and emotional clutter, we are supporting our body's natural ability to heal and thrive. But it's not just about eliminating stress, it's also about adding in healthy stress. Movement, for example, is a positive form of stress that helps build resilience, strengthens your body, and balances your hormones. Whether it's walking, swimming, dancing, whatever, find something you genuinely enjoy and make it part of your daily routine. Aim for at least 30 minutes of moderate movement. This not only helps balance your hormones and reduce stress, but also improves your sleep quality, creating a powerful ripple effect on your overall health. And let's not forget how powerful having a purpose can be. Finding meaning in your life creates a healthy type of stress that energizes you and keeps you moving forward. Now, you're not just managing stress, you are mastering it, creating space for healing, vitality, and balanced life. Sometimes supplements can also provide that extra support your body needs. Three I will recommend today. Later, I will recommend more targeted supplements. But in general, magnesium. This mineral supports over 300 biochemical reactions in our body, including muscle function, blood sugar control, blood pressure regulation, metabolism in general, muscle relaxation, and also managing stress. Incorporate magnesium-rich food like spinach, almonds, and even dark chocolates into your diet. If your kidneys are healthy, actually, I prefer to recommend magnesium bisglycinate in general to help you relax and sleep better at night, in addition to supporting all these other vital functions. Vitamin D also is critical for your overall health, not only bone health, but also immune function and hormone balance and other things beyond the scope of our talk today. So get out in the sun and incorporate fatty fish into your diet. Ideally, also, I would recommend that you go on when you visit your physician, check your vitamin D levels and aim for optimal level. Also, vitamin B complex is important for energy production, hormone balance, and also optimizing the detox function of liver. Foods like eggs, legumes, and dark leafy greens are excellent sources. Finally, I will touch on hormone replacement therapy. Balancing your hormones might involve bioidentical hormone therapy. In my opinion, this is crucial that this is done under the supervision of an expert physician with rigorous follow-up to ensure you are on the right dose and you are the right candidate. There is strong scientific evidence that hormone replacement therapy can improve sleep, mood, and reduce also the hot flashes or even eliminate it. But in my experience, women who make lifestyle changes, the aforementioned lifestyle changes, the simple lifestyle changes, especially around the two master keys of personalized nutritional plan and stress mastery, often require lower doses of hormone replacement therapy, or like me and many of my clients, don't need it at all. So start with lifestyle modification. Not everyone will require the hormone replacement therapy if you really do it right. Thank you for joining me on this journey to better understand and manage perimenopause. Remember, you have the power to transform your health and restore your vibrant energy by addressing the root causes. You are in control. Okay? So, as a bonus for staying until the end, don't forget to download the workbook I created for you. It will help you process everything you've learned today in this video and confidently put it into action. I invite you to share in the comments what 3 simple actions will you commit to. Let's make it one. Let's make it easy, because something is better than nothing. Okay, so what is the simple action you will commit to this week to honor yourself? Because when we take care of our health, it's part of honoring and respecting and loving ourselves. And you deserve the best, my dear. If you find this helpful, please like, subscribe, and share it with anyone who might benefit. I believe in you. You are valuable and your health is priceless. See you in the next video.